Pandemics are a scary thing and can have a lot of negative effects on society. Pandemics can cause widespread illness and death, disrupt economies, and lead to social unrest.
I'd say 6 months ago that I was pretty much a typical teenager.
I had this anxiety and stress of school.
Stress between school and extracurricular activities.
My mental health was better than it had been in a long time.
I was pretty happy most of the time.
I was just waiting to hear back from colleges, very excited. But,
COVID-19 can be characterized as a pandemic.
The coronavirus is a pandemic.
Many schools around the world, as you know, are shut down.
It's going to have a huge impact.
Good afternoon, my name is Justice Miller, and these are the detrimental effects of pandemics. So my research question today is, how have young adults in the United States persevered through the negative effects of pandemics in the past 15 years? And my argument is, young adults of the United States have been majorly impacted in a severely negative way due to pandemics. Some possible solutions to making it through pandemics is staying home and quarantining if you are sick, checking up on your loved ones, and creating a sound financial footing for pandemic preparedness and response. One obvious negative effect of pandemics is the toll they take on public health. During a pandemic, large numbers of people can become sick or die, which can put a strain on healthcare systems and lead to shortages of medical supply and personnel. This can make it difficult for people to get the care they need, which can increase the risk of other health problems. According to PubMed, the swine flu pandemic of 2009 usually causes an acute and self-limiting illness, but may cause severe complications and medical conditions. In serious cases, the virus can cause pneumonia, which can be fatal in the young. As you can see here, the hospitalization rate for the swine flu in 2008 was highest in the age group of 5 to 24 years old. Physical inactivity is one of the most important risk factors for major disease morbidity. As young adults are closely coupled to school-related sport participation, the closing of schools during the COVID-19 pandemic compromised physical activity participation for many students. According to this table, all physical activity per week decreased by 24%, as you can see here, and the number of hours per day spent sitting increased by 28% during home confinement, as you can see right here. This goes to show that there is a correlation between COVID-19 and a decline in physical health apart from the illness. Another negative effect of pandemics is the economic impact. According to health policy, the SARS outbreak was considered the first instance of a concurrent global concern for the economic impact that might result. During the outbreak, there was a noticeable downturn in travel and tourism income for many infected countries. Even countries with no reported cases were still affected economically. Another economical effect that affected many financially was the stock market crash due to COVID-19. On February 20th, 2022, the stock market across the world suddenly crashed after growing instability due to the COVID-19 pandemic, as you can see right here. In addition to these negative effects, pandemics can also lead to social unrest and long-lasting emotional effects. When people are forced to stay home, they may become frustrated and/or anxious, which can further lead to protests, riots, and other forms of social unrest, which further destabilizes society. According to current psychiatry reports, 3 years after the end of the swine epidemic, about 14% of interviewed hospital staff still showed moderate depressive symptoms, and 8.8% reported high symptom levels. The influenza virus most commonly affects the respiratory system, but the virus has been implicated in many neuropsychiatric disorders. Acute swine flu varied from behavioral changes, fear of misdiagnosis, and multiple sclerosis. Among the chronic manifestations, schizophrenia, Parkinson's disease, dementia, and even mental retardation, further research is required to understand the chronic manifestations of the swine flu. Circling back to possible solutions, Pandemics are random and aren't easy to prevent, but there are many guidelines that people can follow to stay safe and further thrive throughout a pandemic. The first and most important solution is staying home if you are sick to prevent spreading any illness to anyone. Another possible solution is checking up on loved ones. Pandemics can be rough on an individual's mental health, especially with the copious amounts of isolation, so making sure friends and family are okay is very important. And one last solution is creating a sound financial footing in the case of a pandemic, which can ensure your finances are stable and secure. This can be done by setting aside enough money to support you during a pandemic and an emergency savings account if worse comes to worse. Now, although these are useful solutions, there are some limitations. Some people are asymptomatic and don't show symptoms, which can lead to exposing many others. And since they don't believe they are not ill and they don't know they're spreading it, that can be very problematic. And now, even if you stay home while ill, you still risk getting the people at home sick. Another limitation is reaching out to loved ones. Reaching out to loved ones isn't easy during a time like this, and being there for your loved ones as much as you would like to can also be hard when you have a lot going on. And one last limitation is financial freedom. Not everyone is financially free enough to set up a fund in case of an emergency, as some people live paycheck
Check
to
1
paycheck.
2. Check 1 2. Check 1 2.
Overall, pandemics can have a wide range of negative effects on society. While it is important to take steps to prevent the spread of disease, it is also important to be aware of the potential consequences of pandemics and to take the steps to mitigate their impact. Thank you. Are there any questions?
All right, 2 questions. First question, how valid and reliable were the sources that you used, and then how do you know they were?
So I believe the sources that I used are very valid and reliable because a lot of them were like CDC articles and like the CDC guidelines, and I also used, majority of my sources were peer-reviewed journals and academic journals, and they did a lot of testing and interviewing and just measured their results.
All right, and what advice would you have for other people who do this topic in the future?
I would definitely recommend to, like, depending on your timeline, to find like the pandemics in your timeline and just kind of do all your research on them and see like how people were affected by them, and to like make a more specific research question, see who was most affected